We are back live inside Studio 10. It's Monday. That means it's time once again for On Your Health, where we discuss important medical and health topics with the doctors of Florida Medical Clinic. It's the Bay Area's first clinic to merge both primary care physicians and specialists, all conveniently under one roof.
Today we welcome Dr. Edgar Ramirez-Pagan to discuss the current state of affairs in the field of interventional pain medicine. Welcome, doctor. Pleasure to have you.
Good morning. Thank you for having me.
What exactly is interventional pain medicine? Sounds very complicated.
Well, first it's pain medicine. So it's the specialty in medicine that deals with the diagnosis and the treatment of pain, whether it be back pain, which is the most prevalent type of pain, or pain that you have in your face, or some other type of pain.
Pain anywhere, but boy, back and neck pain is just, it's awful. It's you don't realize how much you move your neck in the course of the day until it hurts to move your neck.
It's correct. It's very, very prevalent, and I think it's because we are more active as individuals. As time goes on, we tend to do more and more.
Now, there are so many different varieties of pain, so many different ways to treat it. One thing that's, I mean, it's an epidemic right now. If you don't have a friend or a family member who's dealt with pain medicine issues, you're very fortunate because it's going on right now. What kind of advice and care do you offer in that field?
You're correct. It is an epidemic. And it's an epidemic to such a degree that we've enacted laws and there are rules now to adequately guide physicians to help individuals. Pain medicines were originally created for individuals who suffered from cancer pain. And we know that over time, unfortunately, those patients succumb to their disease. Now we're treating individuals who have non-malignant type conditions, back pain, which is the most prevalent. And back pain may put you out, but it won't kill you.
How did it get to the point where there were doctors, and that, and they're still cracking down on this, that were, prescribing the, I believe they're called opiates,
Yes.
Hydrocodone and oxycodone and so forth?
Yes.
How is it possible that you could even get more than 3 or 4 of those at a time? I mean, people were walking out with jars of these things. How did it get so out of control?
I believe that, unfortunately, we did have a couple of unscrupulous doctors out there that were overprescribing. Obviously, when you're board certified and when you take this as a specialty and take this as your calling, you really focus on multiple approaches to this. And the medication is just one small approach to this. And then we talk about interventional aspects of treating conditions, because a lot of these things can be dealt with in more than one fashion.
And you were telling us you can do some of this stuff without even without using a scalpel, without using a knife. It's non-invasive.
Correct. There's quite a variety of treatment modalities that we can use, especially for.
What are we looking at here?
Particularly the first part is a herniated disc, which is the most common complaint when patients come in with back pain and then they get the leg pain, which is what we call sciatica out in the population.
When a disc is herniated, exactly what does that mean?
It's bulged out.
And why is it bulging?
It could occur for many different reasons. We don't have clear explanations why in medicine, but we know that it causes a lot of pain.
And that pain is, it's affecting your nerves. That's why you're feeling that pain, nerves on your spine. Is that, so it's not like your body's healing or getting better. It's degenerative.
Actually, not so much degenerative, but yes, your body's feeling it because that herniated disc or the disc bulge can pinch the nerve, which is right lateral to it, right next to it, and cause leg pain.
But I thought the only way around this was surgery, and you're saying you can just take a needle and go in and take care of things.
Not all patients need surgery. Okay. Surgery is an option, but obviously it's a option of last resort because individuals can do much better with conservative treatment modalities, physical therapy, maintaining a rest for a little while, then comes into what we do. We can either remove pieces of disc or we can lesion inside the disc, causing the disc to shrink. And this is all done as an outpatient.
You have all kinds of treatments, also nerve blocking, just a variety of ways to attack whatever the situation is.
Correct. Back pain can encompass many different aspects, and according to that aspect, then we can do things to maintain individuals' functionality, ultimately keep them functional and limit the use of their meds.
So as Roxanne alluded to, of course, through medication, nerve blocks, what is nerve burning exactly? Is that what I think it is?
Yes, it's more sort of a nerve ablation. Sometimes some of these nerves we can get access to them and we can burn them.
You just sort of dissolve the nerve, or how does that work?
Correct, with heat.
Okay.
You dissolve the nerve, and that helps with the pain. Doesn't completely take the pain away, but it enables them to get past this. I see a lot of patients with this hump where they're in this this hump where they can't get out of pain, so we provide this modality so they can get back to normal physical activity and then get back into their lifestyle, start exercising and doing their daily routine.
Dr. Ramirez, what if you have a patient who is coming in for surgery, maybe shoulder, knee, something that's in one particular area, and they say, you know what, I want to be proactive. I don't want to find myself needing to take all these pain pills. What can they do on the front end, or how can they watch themselves? I've seen friends go through this where they say, oh shoot, I need these pills all the time now. But what advice do you give them?
Very good question. We have quite a bit of those patients. Preemptively, sometimes we treat individuals with different type of medications. There are nerve medications out there that we call them neuropathic meds that we preemptively give individuals so that at the moment of surgery or after surgery, because the surgery is a intentional injury, that their perception of the pain isn't as high as it would be without that, because afterwards, yes, we treat them with pain medication, but we want them to be able to get over this period in their life as fast as possible.
What advice would you give to everybody who's watching that maybe, say your back's in pretty good shape, how do you keep from goofing up your back? I mean, what's the #1 way people injure their backs? What are we all doing wrong?
One, I think that people should maintain as much physical activity as they can and then listen to their body. We don't know clear reasons why this occurs. There's some theories out there where it would be genetics and some of our genes, which compose some of the molecular or the protein structure in our body, degenerates quicker in other individuals than not. But the most important thing is to maintain a healthy, strong lifestyle where you exercise and strengthen the muscles along your spine. They talk a lot about core exercise and core strengthening. A lot of athletes focus on core. Why? Because then when you have an injury or something occurs, then your core is strong and you have less of a potential for further injury at the end.
And the nice thing is at Florida Medical Clinic, you have doctors who are specializing in whatever treatment you're coming in for, whatever part of your body it is, and then also doctors there who are treating the patient as a whole, so their best care is being provided.
Yes, we are a multidisciplinary group. We go from primary care to your subspecialist, including myself and other individuals, and then we all share the same notion of keeping that patient or that individual as healthy as possible, but sharing the information so we don't repeat diagnostic tests or other laboratory example or labs that are necessary. So we all share information and we all have the same goal.
Thanks for bringing in the cool prop, by the way.
Thank you.
You gotta love a good prop.
I stole that from the office, Mr. Burns.
We'll get it back in before you get caught. Hey, if you'd like to learn more about the latest advances in patient care and medical research, by all means visit Florida Medical Clinic online at floridamedicalclinic.com. And while you're there, you can locate the office nearest you, learn about their doctors, and even request an appointment, such as an appointment with this doctor. Thank you again.
You're welcome.
Up next, we're going to talk with Maxim Magazine's senior editor Patrick Caroni about a men's fall fashion style survival guide. We'll be right back.
This segment was sponsored by Florida Medical Clinic.